Did you know that you can die from drinking? If you are like me, you've probably seen people laugh at others who are drunk. And it's even funnier when they pass out, right? But it's not cool to think about choking on your own vomit or dying because your brain wasn't able to tell your lungs to breathe or your heart to beat. It's called alcohol poisoning, and it can kill you. This brief tutorial was designed to help college students identify the symptoms of alcohol poisoning and know what to do to seek help. First, it is important to know that alcohol poisoning can be fatal. Alcohol poisoning is a serious, sometimes deadly result of consuming too much alcohol, basically an alcohol overdose. Alcohol is a drug that depresses nerves that control involuntary actions such as breathing, heart rate, and the gag reflex. A fatal dose of alcohol will eventually stop these functions. You should also know that a person's blood alcohol concentration, BAC, can continue to rise even after he or she has passed out. Even after a person stops drinking, alcohol in the stomach and intestine continues to enter the bloodstream and circulates throughout the body. It is wrong to think that a person will be okay by sleeping it off. Since many different things like height and weight affect the level of intoxication of an individual, it is difficult to tell exactly how much alcohol is too much. However, there are some important signs of alcohol poisoning that you can watch for. They include the inability to wake the person for more than a few minutes, mental confusion, passing out, vomiting, seizures, slow or irregular breathing, or lapses in breathing, and low body temperature. Remember, any one of these symptoms could mean that the person has alcohol poisoning. It is important to know what to do to seek help. A person with alcohol poisoning will not sleep it off. This can result in death. Even if a person survives alcohol poisoning, it can lead to irreversible brain damage. Here's what you should do if you see one or more symptoms of alcohol poisoning. Call 911 for help. Stay with the person until help arrives. Turn the person on his or her side to prevent choking if the person vomits, and be prepared to give emergency medical personnel as much information as possible, including any drugs or medication taken by the person. Monitor the person's breathing. If the breathing stops, perform CPR. Remember, alcohol poisoning can be fatal. Recognize the symptoms and take action. Trust me, you won't be sorry.